This time, Don Miller is going to talk with you again about some of this potpourri of small remedies. Don Miller?
I want to revisit just for a minute your serpentarium, okay?
All right.
Can I go back to the snakes? It was interesting. I was in Zambia some time ago, and they were telling me that, you know, we're really having a lot of black mamas and cobras right now. And of course, the first thought is, whoa, those are some pretty serious snakes. But to comfort me, they says, no problem. We've got lots of charcoal on hand. And so that's one treatment for snake bites that I really agree with. They did tell me that there was no antivenin there, and if someone did get bit by a snake and there was no zappers or bloodsuckers, these other types of things, we would apply heavy charcoal poultices or complete charcoal immersions and then transport them to a hospital or a clinic where they would have the antivenom. And that's very good treatments that I would choose. Other things you find around the home, you find down the street, you find around the world are things like wounds and infections. We all get them. Sometimes we cut our finger, we step on something and we've got a wound. What do you do? I would recommend that each one of you find an organization in your community that presents a good first aid course. I know the American Red Cross. I'm an American Red Cross first aid and CPR instructor. How to do these simple things, but there's some really basic things. One, if you have wounded yourself, you make sure that you remove yourself from the area where you wounded yourself if the possibility exists that you will continue wounding yourself. I once cut off the tips of my fingers with a table saw, and the first thing I did was to turn off the table saw and get away from that table saw, because, you know, if you get woozy and you fall down, you might really have a problem on your hands. Besides the fact that you're missing a couple of digits. And so those are nice things to do is watch the area, make sure you're not going to re-injure yourself. Two, you've got to protect your wounded area, and you've got to clean your wounded area. And the best way to do that is with flushing water. Get the water in there and flush it out. If you can get some hydrogen peroxide, that's also very good. It's good to do it under pressure sometimes. If you can have a bulb syringe and you can sit there and jet it in there, a water pick. I've used something as simple as a water bottle. Just take the water bottle with water in there and turn it upside down and just squeeze real hard to get a good jet of water in the wound to clean it, because cleaning is fundamental. What I would do then, if I had it, I would apply some tea tree oil to a dry sterile dressing. And if I don't have that, I'd put, first of all, just a dry sterile dressing over my wound to protect it from outside pathogens, because quite frankly, this is our first line of defense against infections, our skin. I'm thankful for my skin, but as soon as I violate this skin, as soon as I open this skin up, everything around wants to get in there and mess up my body. So we want to protect it as soon as possible. We want to make sure we are changing the dressing at least on a daily basis, and once it's starting to heal, if you happen to get an infection, I will slap a charcoal poultice on that thing in no time, because the charcoal poultice will help take up infections. And so you keep it sterile, you keep it clean, you keep it protected. And what I like to do sometimes when the sun's shining, I like to expose it to the sunshine, because the sunlight has a natural effect on killing bacteria and other types of pathogens that may be on our skin. So we want to get that in there, and we want to keep ourselves well hydrated and eat very healthfully, because as soon as we violate this part of our body, we're open to have things going all through our body. So if we keep our body strong, our immune system's going right there. Stay away from sugar, stay away from sweets, so that our immune system is operating 100%, and we should pretty much be able to get away from this problem. And there are some other nice herbs where you can put some golden seal, we can put some echinacea on it, poultices, we can use some aloe vera. Simple things. God has given us simple things, and I suggest we go out there and use those things, and we might be a whole lot better for the exercise, Dr. Thrash.
Yes, those are certainly very good suggestions. One more thing that I might mention, and that is the use of something like petroleum jelly for eczema. I think it's one of the very best treatments for that, and all you have to do is just to take a little lump of petroleum jelly, such as this, and some water. And usually this can be done right after you have washed your hands, and your hands are still wet with the water of washing your hand. And then you just put this there, and with a motion like this, you rapidly as you can do, you make a sort of a milk. You see, this looks a trifle milky, and then it's spread on the area where you have the eczema in the direction of the skin lines. Now, you know the skin lines go across here. Other parts of the body, they take another direction, but whichever direction they go, you always put it in the direction of the skin lines, because if you pull like this, then you may open up these little skin lines, and with eczema, that can cause a problem, because the opening up of the skin lines is what keeps eczema going. It may not have caused it, but it does keep it going. Now, I hope from this potpourri of things, of small remedies, that you can get the idea that our Heavenly Father has provided for us in many different